Hi, I'm Charles Wonsono. I'm the Healthcare Business Director for Siloam Hospitals Group. Siloam holds a strong foothold of the private hospital market with 41 hospitals and 70 plus clinics across 70% of Indonesia's provinces. We are the largest private healthcare network in Indonesia. To support this large pan-Indonesian operations, we really needed to find a partner who believed and also trusted us in our vision and mission for Indonesia. We know that Indonesia is a supply-constrained market. We have a lack of both healthcare facilities as well as physicians and medical staffs. Early on in our journey, we had a vision of establishing hospitals across Indonesia that would serve and reach all Indonesians. And why we chose Philips over third-party engineers is because Philips understood that vision and was and is still very supportive of that vision.
Over the years, with the increasing patient volume, now we see challenges related to managing our aging equipments. Philips' technical team works closely with us to understand our specific needs and addresses potential issues before they affect our operations. Their approach includes frequent communication and regular proactive visits to check and monitor our equipment stability and prevent malfunctions. Additionally, Philips also has established their dedicated warehouse for spare parts, which reduces the time needed to replace the faulty components. It aligns well with our goal of maintaining a high standard patient care and uninterrupted care.
There are three things that we really look into. The first one is effective and proactive predictive maintenance, which is very crucial, and this is something that Philips thankfully has been very supportive of. Second is beyond uptime, maintenance is needed to cover upgrades of hardware, and now more importantly than ever as we enter the fourth industrial revolution is on softwares. Both hardware upkeep and also software upgrades, which includes AI, is important because that allows Siloam to continue to be at the forefront of clinical excellence in Indonesia.
The engineering team responds promptly, addressing errors remotely within the first few minutes, followed by an on-site check. They make every effort to procure the parts on time and expedite the custom process so that they can be installed on-site as quickly as possible. They not only supply the necessary spare parts, but also bring parts that have the potential to cause issues.
Our hospital management and also medical staff sing praises for Philips equipment. This is due to the robustness of their equipment, but more importantly is because of the service quality of their service team.
The ongoing communication and collaboration with Philips teams has fostered a strong sense of support and confidence among our team, enhancing our overall operational efficiency.
So this partnership with Philips, which we enjoy, truly extends beyond the boardroom into our hospital operations to make sure that we can both continue to provide the best service to our stakeholders and the best clinical care to our patients across Indonesia.
Philips.